Hello, everyone. Thanks for joining me again this Monday. Today, I want to talk about something that I saw within the week that caught my attention. I saw some whites who have begun questioning why Africa's successful approach to COVID 19 are being overlooked by the Western world. When the virus started spreading out of China, especially into Europe and America, everybody was afraid. Everybody was concerned that what would eventually happen when it gets to Africa, looking at its limited resources, its limited expertise and finances, and you name the rest. And so it became a global concern. For this very reason, African leaders began mobilizing efforts on how to get prepared in the event that the virus gets to the continent. And so they started working as early as when the virus spread out of China. I mean, some African countries even imposed lockdowns before recording their first ever death, not to talk about the closure of borders and the rest. And also, the African population, I can say, because of their experience with other outbreaks such as Ebola and SARS, were not neglecting their personal hygiene and other remedies. I mean, in a country like Guinea, for example, in every house, every market, everywhere, every corner, you will see buckets of water and bleach as an available and local disinfectant. And it's quite effective. You would see even on trees and gates a bottle with the water and bleach mixture, just to see how people can disinfect themselves and their hands on the go. This is just general recommendations everywhere. Today, I want to talk about some of those things that Africans have been doing that is worth emulating, because they have been saving lives, and what has been accounting for its slow rate in the continent. I want to begin in Senegal. Do you know that in Senegal, health and laboratory experts they are producing test kits that cost $1. Yes, $1 as opposed to £250 in the UK. Yeah, I saw testimonies this week. And besides the cost, the enormous cost difference, these test kits can actually detect the virus in 10 minutes. Not only that, they can as well detect previous infections due to previous infections from antigens taken from saliva and antibodies. Let's go over to Ghana. Ghana also depended so much on an extensive contact tracing strategy. And through this contact tracing, they also do what they call pool testing. That is, they test so many people, they do blood test and the rest, and only test for COVID-19 for people who have a lead, because we know there may be limited number of test kits, of the COVID-19 test kit, and so they will only test for those that have a lead or have the need to. And that way they are following up on patients who are among people. Everywhere in Africa there has been extensive contact tracing. Let us also look at Cameroon. In Cameroon, we saw how engineers of l'Agence Universitaire de l'Innovation in Bafoussam innovated ventilators, the much needed ventilators that uses solar energy. Over in Rwanda, we saw how robots were created to replace some of those risky activities that health personnel do or carry out in the course of their duty. And I also want to talk about, there is also in many parts of Africa, there is an app, a mobile app that can actually trace where and when a patient contracted the virus, so that they can intend follow and see how they can separate such people from the society before they contaminate others. And these are some of the things that have been making Africa to not face the effect like other parts of the world. And also there is an institute, a reputed and respected institute in Germany. I think it is the Max Planck Institute of Colloids and Interfaces in Germany, that has been doing clinical trials on the famous artemisia plant that Madagascar is using to make its herbal cure for COVID-19. And so far, they say their results have been very interesting. It was revealed by its director, that is Professor Peter Seeberger. Yeah. So all of these things we can say are accounting for why Africa has shocked the world and is not dying as some people would have expected. You see, my problem is not even why this is not getting the fanfare. Why I'm concerned is what is causing, what is limiting these strategies to not be uploaded or emulated by other countries when it is actually saving lives. And so the only reason why I think this is happening is because Africans themselves do not believe in their own. Anything that comes from Africa has that negative, when you see it, there is that disbelief and lack of confidence. No, if Madagascar's president did not stand up with boldness and declare to the world that they have a cure for COVID-19, nobody would know, and nobody would even look into it. Even the other African countries that have been showing a motion of support and consuming such drug, they would not do it. So if we don't believe, if we don't talk about our own successes, who would? Nobody would know. If we don't talk about Africa's emergence, the Western world will not know. You understand? And even when these things are being reported, Africans themselves don't follow. They don't see, they don't watch it. They don't know, so they can't share it, they can't talk about it. There is that lack of confidence among Africans. If we do not believe in ourselves, we would not. This pandemic has only come to show that Africa is not as weak as it is made to look like. Africa has its strength. I even forgot to say there is this report, a classification that the Secretary General of the UN Envoy on Youth made about the 10 youths in the world who have done so much of innovation after this outbreak of the pandemic. And out of the 7 continents in the world, Africa had 4. So 4 of those 10 outstanding youths are actually from Africa. Africa, we need to rise up and change the narratives. No one will do it for us, but we will do it ourselves. And that is all that I had for you today. Thanks so much for watching. Have a blessed day. Bye bye, and see you next week.